Normal CBC, TLC 4000 to 10,000, neutrophil 40 to 70, lymphocyte 20 to 40, hemoglobin 12 to 17, packed cell volume 40 to 48, platelet count 1 to 4 lakhs, and RDW 11 to 16, MCH 27 to 34, MCV 76 to 96. If fever is more than 101 degree and with no obvious cause and present for more than 2 to 3 days, we should do CBC, urine examination, and malaria, dengue, and typhoid depending on the symptoms. Leukopenia, dengue, typhoid, and malaria TB, leukocytosis, complicated typhoid, scrub typhus, leptospira, and liver amoebiasis, and hemoglobin is low in malaria. Hematocrit can be low in dengue due to decreased RBC production and high in dengue due to plasma leakage. Lymphocytosis, viral and rickettsial infection, relative lymphocytosis, brucella, lymphoma, and Whipple's disease, and relative lymphopenia, CMV, HIV, and Q fever, and atypical lymphocytes, EBV and CMV. Eosinopenia, typhoid, malaria, monocytosis, malaria, basophilia, leukemia, lymphoma, eosinophilia, histoplasmosis. Next, thrombocytosis, chronic infection, subacute bacterial endocarditis, Q fever, and vasculitis, thrombocytopenia with bleeding dengue and with splenomegaly, malaria, and pancytopenia, TB, brucellosis, and HIV. These are more than 100 infections: subacute bacterial endocarditis, abscess, osteomyelitis, TB, UTI, rheumatic giant cell arthritis, rheumatoid arthritis, malignancy, leukemias, and lymphomas, and carcinomas. Urine examination performed in women and elderly and severely ill and diabetes patients with fever, and proteinuria and hematuria, leptospirosis, and hemoglobinuria seen in malaria. Serum bilirubin elevation seen in malaria, leptospirosis, AST-ALT more than 1000 in severe dengue. Raised bilirubin, moderate elevation of ALT to 200 plus raised CPK is leptospirosis. All patients with tachypnea and severe illness, we do X-ray, ARDS, scrub typhus, leptospira, malaria, and pleural effusion, dengue fever, consolidation, bacterial pneumonia, heterogeneous opacities, TB, and deranged KFT, malaria, scrub typhus, and leptospirosis. Ultrasound abdomen for abdominal pain, jaundice, shock, hepatomegaly, and fever without obvious cause. Test for acute undifferentiated fever, malaria, RDT for malarial antigen and smear examination, dengue, NS1, IgM, and culture of RNA, and typhoid, typhoid blood culture, and space occupying lesion in liver abscess, and mesenteric lymph nodes is seen in typhoid and TB, and ascites and gallbladder edema is seen in dengue. Scrub typhus, RDT for IgM and Wheel Felix test. Leptospirosis, RDT for IgM if more than 1 week, and blood or CSF culture less than 10 days. Chikungunya, RT-PCR for viral RNA and IgM by ELISA. URTI, rapid antigen throat culture, LRTI, chest X-ray, sputum, IFB staining and culture, and UTI, urine routine and culture, IAI, stool culture, and SSTA, pus culture, BJI, synovial fluid gram stain and culture. MCV low, MCH low in iron deficiency anemia, MCV high but MCHC normal, vitamin B12, MCV low but MCHC normal, normochromic, thalassemia, MCV normal, MCHC normal, anemia of chronic disease. Increased red cell distribution with iron deficiency, anemia of inflammation, and hypothyroidism, and megaloblastic anemia, whereas normal RDW, thalassemia, bone marrow aplasia. MCV more than 95 with increased reticulocyte, hemolysis and blood loss, normal reticulocyte, MCV more than 115, likely folate or B12, but MCV not much raised in case of hypothyroidism, liver, alcohol, Down syndrome, folate deficiency. Observe this test: TLC decreased with hemoglobin, PCV decreased, and RBC count slightly decreased, and platelet count is also decreased, suggestive of viral etiology, mostly of dengue. In case of typhoid fever, normal WBC is seen in 64%, leukocytosis 80%, leukopenia 3%, normal neutrophil 63, neutrophilia 9, and neutropenia 3, normal eosinophil 75, normal hemoglobin 29, anemia in 46, platelet count, there is normal platelet in 45%, and thrombocytopenia is 30%. This is a blood report of typhoid patient where CBC is normal but IgM typhoid is positive. Similarly, in malaria, anemia is seen in 67% and normal hemoglobin 30%. Thrombocytopenia 87%, normal platelet 13%, normal WBC 86%, leukopenia 10%, leukocytosis 4%. But there is peripheral smear showing malarial parasite identification.
was tested positive for dengue yesterday, फिर उसके बाद उसके हीमोग्लोबिन ड्रॉप हो रहा था, मतलब कहीं इंटरनल ब्लीडिंग हो रहा है and his bilirubin was 18.4. मतलब liver भी damage हो रहा है. With a platelet of just 18,000, इसको हम expanded dengue syndrome बोलते हैं. फंडा ये है कि don't take dengue lightly. Get your
Dengue treatment mainly include paracetamol and adequate hydration by ORS or IV fluids. Whereas typhoid, cefixime 400 BD for 10 days or azithromycin 1 gram per day for 5 days. Whereas leptospirosis 100 mg BD for 7 days, same as for scrub typhus. URTI amoxiclav, LRTI amoxiclav plus if there is comorbidity we give azithromycin. Complicated pyelonephritis, piperacillin, tazobactam, and in case of malaria, if it is chloroquine susceptible, in case of Vivax we give the treatment, and along with we give primaquine. Whereas in case of falciform malaria, which is more serious, we give combination therapy and single dose of primaquine.